Hi viewers, you're welcome to my YouTube channel, Chizi Vlog. My name is Nurse Chizoba. I'm a cardiothoracic nurse. Here I talk about educative content that spice up life. Today I'll be talking about sickle cell disease implications and what people need to know about it. Click on the subscription button for more updates and then videos. What is sickle cell disease? Sickle cell disease is a group of blood disorders that involve the genetic mutation of hemoglobin content of red blood cell. When this hemoglobin content of red blood cell is interrupted by abnormal proteins, they tend to make the red blood cell, which is normally disc-like in shape, to become sickle shape. And when this red blood cell becomes sickle shape, the blood finds it difficult to pass through the vessels. It causes occlusion of the blood vessels and thereby leading to pain that could lead to that can last for several days. Aside pain, there are other complications it come with. It can affect the heart, it can affect the brain, that is causing stroke. It can um, it can affect the bone, making the bones weak. It can as well affect the kidney. So there are a lot of complications that this sickle cell disease can come up with. So, and this disease condition is preventable. But what I'm talking, the main focus of today is the implication that it comes with. So, what are these implications? One is financial instability. How does financial instability occurs in the life of people with sickle cell disease? When these people come to hospital, they end up spending about 85% of their income in healthcare, and it is just not easy on them. When you see them, you know that they are really stressed out with this situation when it comes to healthcare delivery to these patients. Another implication it could lead to is, or sorry, it leads, or rather, it leads to is frequent visitation to the hospital. Particulars or those with sickle cell disease condition frequent the hospital just to receive health care. And then this as well cost them their time. Another problem or challenging experience that they face is problem of stigmatization when it comes to job, that is employment, and then when it comes to relationship. In terms of job, people with sickle cell disease end up forging their medical reports because most of companies don't like to employ them. No company would want to spend his or her money on sickness. Instead of making income or generating income from the employee, they'll be spending on the employee. So they tend not to employ them, and they end up doing what? Forging their medical reports just to be gainfully employed. Aside that, in terms of relationship, they find it difficult to find out to get someone who is able to take care of them. Even as much as they could finally find someone, family could as well be a problem because the family of a person whose genotype is normal, and then that would want to have or go into marriage with someone who is a secular may end up not wanting their child to marry such an individual, thereby creating problem for this person that is with sickle cell disease. Sometimes these people with sickle cell disease do have suicidal ideation. I've come across a patient who one day told me that she's tired of this life, and then from one complication to another, and then from one hospital to another, that she just want to end it, that she's tired. So, and I had to cancel this person. It wasn't easy for her. She lamented. And then another thing is that the situation sometimes can be challenging to the healthcare personnel taking care of these patients, especially when it comes to um its severe complications like DIC, disseminated intravascular coagulopathy, which sometimes is a dicey situation to manage. Unfortunately, we had lost a patient on this regards, and then I personally wish the society, the individual out there, to put an end to this sickle cell disease for the sake of the future generation. And kudos to those who are out there working on it. Sickle cell disease is not a death sentence. It's not a communicable disease. So those who are already with it can as well be taken care of. Thank you.